Hi, we're the lung cancer nurse specialists and we're going to do a video today on managing breathlessness. My name is Tracy. So first of all, I'm going to talk about the causes of breathlessness. There are a number of causes. The first one, obviously, that we'd first think about is that the cancer could affect the lungs, whether that is a primary lung cancer originating in the lungs or a secondary cancer that has spread from another tumour. We could also get a build-up of fluid around the lungs, which is called a pleural effusion, or around the abdomen, which is ascites, as a result of your cancer. Low levels of red blood cells or anemia can also cause breathlessness. Chest infections your lungs and the air sacs can fill up with mucus or phlegm, and that can make it hard for you to breathe and you can become breathless. Weak muscles. In advanced cancer, the muscles that help your breathing become weak because of fatigue and poor nutrition and weight loss, and that can make you more breathless. Pain can make it difficult to breathe and move comfortably. That can be from an operation or cancer-related pain, and it's important to take medication to help with that. If you have a blood clot in the lung or a pulmonary embolism, you may get a sudden onset of breathlessness and pain, and it's important to get medical attention straight away. Other medical conditions unrelated to cancer can also cause breathlessness, such as asthma, chronic obstructive pulmonary disease, interstitial lung disease, pulmonary edema, amongst others. Smoking can make breathlessness worse. The smoke causes irritation and inflammation of the airways, and so less oxygen is absorbed by the bloodstream. Anxiety can cause panic and quite natural reactions when you have an episode of breathlessness, and we will talk more about managing that during this video. Cancer treatments can also cause breathlessness. Surgery for lung cancer may also cause breathlessness. It involves removing part or all of a lung, and although most people are able to breathe well following surgery, some people do get ongoing breathlessness. Radiotherapy to the chest can also cause inflammation of the lung, which is called pneumonitis, and that can lead to breathlessness, either short-term or long-term. And some chemotherapy drugs can also cause breathing problems. So we're going to talk about some of the treatments that can help you breathe more easily. And the purpose for the treatments are to help relieve breathlessness, as I mentioned about reducing anxiety and panic, how we would reduce inflammation in the lungs, about widening airway passages and increasing airflow, loosening sticky phlegm, and reducing excess fluid in the lungs. So the treatments we will talk about are medication, oxygen, and complementary therapies. So some of the medications that we would consider: painkillers such as morphine, whether that's in tablet, liquid, or injection form, that can help relieve breathlessness. Sedative drugs, such as diazepam or lorazepam, they can help relieve anxiety and panic and help some people who have breathlessness. Steroids can be given to reduce inflammation in the airways, such as following radiotherapy, and that also reduces breathlessness. Bronchodilators are used to open up airways and can be given as inhalers, in tablet form, or through a nebulizer. You can have saline, which is a salty water, and that can be given through a nebulizer to help loosen sticky phlegm. There is also medication to loosen sticky phlegm that can be given orally. If you have fluid within the lungs, pulmonary edema, you can have water tablets, diuretics, which may ease your breathing. Oxygen treatment isn't necessarily used for everyone with breathlessness. It needs to be assessed by healthcare professionals and administered. Sometimes sitting by an open window or using a fan has a similar benefit. Oxygen can be given using a storage tank as a concentrator or in cylinders, which enables you to go out for trips. So I'm going to hand over to Elizabeth, who's going to talk more about complementary therapies.
I'm Elizabeth. I'm going to talk about complementary therapies in detail. Complementary therapies do not claim that they can treat or cure cancer. People might use complementary therapies to improve their physical or emotional health, or they may use them to reduce cancer symptoms or the side effects of cancer treatment. There are many reasons why people use complementary therapies. Some people find they help them cope with the stress of cancer and its treatments. The types of complementary therapy include acupuncture, aromatherapy, and meditation. Acupuncture is a procedure where the therapist applies pressure on specific areas of the body with the aim of helping a problem elsewhere in the body. Aromatherapy is the use of concentrated natural oils extracted from plants. They are called essential oils. Aromatherapists believe they can benefit your body and mind. The aromatherapist will choose the oils they think will benefit you the most. Meditation is another complementary therapy. Meditation can help you relax and calm the mind. During meditation, you learn to focus on the present moment. While doing this, you become aware of your feelings, thoughts, and the sensations in your body. Possible benefits of meditation include you will feel relaxed, feels less anxious and less stressed, and is able to better manage chronic pain. Next, I'm going to talk about the tips to help you breathe more easily. First is the positioning. When you feel breathless, it can help to be in a comfortable position that supports your upper chest muscles and allows your diaphragm and tummy to expand. If you are in bed, make sure you are sitting in an upright position with your back supported by pillows so that you can expand and open your chest area. Allow your head to rest back gently on the pillow so you can feel a release of tension in your neck. Rest your arms against your sides, supported by pillows if this is more comfortable. Next is controlled breathing. Practice controlled breathing when it helps to relax your shoulders and upper chest muscles. Breathe in through your nose and out gently through pursed lips. That's a technique of controlled breathing which you have to practice. Practice the technique when you are not breathless or distressed so you get used to it. The other tip to help you manage breathing more easily is handheld fans or open windows, which will be going into detail in the future slides. Next tip is cool flannel to the face. and the other one is relaxation. I'm going to go in details with regards to the positioning techniques. The first one is seated forward lean or standing forward lean. In a seated forward lean, you sit in a chair and lean forward with your upper body. Have your legs uncrossed, feet on the floor and shoulders relaxed. Slowly move forward a little so that your elbows and lower arms are resting on your thighs, supporting your upper body. Keep your knees shoulder width apart and let your chest relax when you lean forward. The other one is standing forward lean, where you stand and lean forward onto a secure surface. Let your arms and elbows rest on the surface so that you are supporting the weight of your upper body. Keep your shoulders and chest relaxed by letting your forearms remain shoulder width apart. The next position is seated forward lean with table, where you sit in a chair and lean forward with your upper body. Have your legs uncrossed, feet on the floor and shoulders relaxed. Slowly move forward a little so that your elbows and lower arms are resting on a table, supporting your upper body. Next, I am going to talk about the breathing technique. So, if you practice this when you are not too short of breath, you will become familiar with it, and so you will be able to use it to help you when you are more breathless. Sit comfortably with your neck, shoulders and back well supported. An upright chair is ideal if you can tolerate it. Relax your shoulders. Breathe in gently through your nose if possible. Try to use your lower chest to breathe, so when you inhale, it is your tummy area that expands rather than your upper chest. Breathe out slowly and watch your tummy sink back down. How to check whether you are breathing from the lower chest? Place your hands on your tummy, just below your rib cage. As you breathe in, you should feel your hands rising. As you breathe out, your hands will sink back down and in. Your upper chest and shoulders shouldn't move very much at all. Once you are in a comfortable position, try breathing in through your nose and out gently through your mouth. Some people find it helpful to breathe out through pursed lips, as if blowing out a candle. If you find breathing in through your nose difficult, breathe through your mouth instead. When you breathe out, feel your shoulders and upper chest relax. As you breathe in gently, keep your shoulders relaxed. Breathe in slowly and out gently, feeling your upper chest muscles relax more and more with each breath out. There's a little video you can watch on YouTube with the link which explains the procedure in detail. Next, I'm going to hand over to Jaylette, which she will explain more about handheld fans in detail.
Hi, my name is Jaylette, and I'm going to talk about handheld fans. Using a handheld fan is a simple but important way of easing breathlessness. It can help you recover more quickly when you experience breathlessness. You may also find a floor standing fan or desktop fan effective. Carry a fan with you to help you whenever you need it. Fans are small and light and easily fit into a handbag or pocket. When using a fan, get into a comfortable position. If you're uncertain about positioning, ask a doctor, nurse, or physiotherapist at the hospital or at your GP surgery. Hold the fan yourself if possible, about 15 centimeters or 6 inches away from your face. Let the cool air blow towards the upper and central part of your face, always including your nose and mouth. Sitting in front of an open window with the cool air blowing over your face can be very helpful. Some people find putting a cool flannel on their face effective. There's a short video created by Cambridge University Hospital which can be seen on the link provided on the YouTube channel. I'm going to talk about managing everyday activities. The main aspects of managing everyday activity is to prioritize, plan, pace yourself by taking breaks, and I'm going to talk about how you manage around the house. It is good to keep active, but when you're feeling breathless, everyday activities can sometimes feel overwhelming. Some of the following tips may help. Prioritizing. Save your energy for the things that most need doing or are most important to you. Before doing a task, consider whether you need to do it. If it's not necessary, choose not to do it. If it's a more strenuous task, ask family or friends to help. Do everything the easiest way you can. Give yourself extra time to do things so that you're not rushed or stressed. You will be less likely to become breathless. Planning ahead. It's possible to make some tasks easier by planning ahead. For example, doing your shopping online or asking someone to do it for you. Most supermarkets offer online shopping and some delivery. You might also find that tasks are easier at a certain time of a day. If that's the case, plan ahead so you can do the things you want to do at times when you are likely to find them easier. Pacing yourself. Keep a balance between periods of activities and periods of rest. You may want to take a break during an activity as well. Around the house, think about ways to arrange your home to make tasks easier. For example, putting a chair in a hallway or on a stair landing so you can rest when walking between rooms. Sit down to carry out everyday tasks like washing, dressing, or preparing food. Arrange your kitchen with frequently used items stored at waist height so you don't have to bend or stretch to cupboards or shelves. Try to avoid bending from the waist down, as this can restrict your breathing. Instead, try easing yourself into a crouching position while keeping your back straight and bending your knees. This keeps your chest upright and your shoulders back. You may find it helps to hold on to a secure piece of furniture, such as a sofa. When you do this, some people find using a pickup stick or a reacher useful. An occupational therapist can give you advice on this. People who can help you. There is help all around you. So the first is GP or your consultant. Your clinical nurse specialist can advise you on ways to cope with breathlessness. Physiotherapists are available in the hospital and in the community. They can teach you breathing techniques and easier ways of doing day-to-day activities. An occupational therapist can help you find easier ways to do tasks at home and may be able to give you gadgets to help with household chores. A dietitian can give you advice about which foods are easier to eat when you're breathless. We also have a wonderful team of palliative care nurses who are based at your local hospice. They can help you with breathlessness management as well. We have resources available for you to have a read through online on our Macmillan website. Here is a link attached, and we have a Managing Breathlessness booklet with a DVD along with the booklet, which can be helpful. We also have resources on complementary therapies. Here is the link to it, and this is the booklet on complementary therapies. Thank you.